session is Dr. Anna Clark. Anna is the editor-in-chief of the Lancet Rheumatology. She obtained her PhD in neuroscience from King's College London in the UK, where she examined neuroimmune components to persistent pain with a focus on cytokine and protease communication between neurons and microglial cells in the spinal cord. She was a postdoctoral research fellow at King's College London and the Medical University of Vienna in Austria. She commenced her editorial career managing a portfolio of journals within the BMC series as an editor at Biomed Central, and then she served as an assistant editor at BMJ Open. She joined the Lancet Rheumatology's launch team as deputy editor in 2019, becoming editor-in-chief in July 2023. So, welcome, Dr. Clark, and I have your slides here. Yeah.
Thank you for the kind introduction. Can you hear me okay?
Yes, we can hear you.
Perfect. Well, thank you for the invitation to speak today. I'm Anna Clark, so I'm the editor-in-chief of the Lancet Rheumatology, which is one of the journals within the Lancet Group. I'm going to talk to you today about the Lancet Group's efforts to improve reporting of lived experience in our research articles. Next slide, please. So just a brief history about the Lancet Group for anyone who's not familiar. So the weekly Lancet journal was founded in 1823, and we recently celebrated the 200th anniversary. It was the only journal in the Lancet Group for the better part of 200 years until the year 2000, when the first specialty journal, the Lancet Oncology, was launched. And then the group has steadily expanded ever since. We are now 27 journals across various specialties of medicine, and our newest journal, the Lancet Regional Health Africa, launched just this week. Next slide, please. So I should say that I'm a full-time professional editor, like Adrian, and my journal, the Lancet Rheumatology, has a team of 3 full-time editors. But we're a highly selective journal and we publish very few research articles. So we actually do have the power to police what is being reported within our journal. So as you're all very well aware, engagement of people with lived experience in research improves research quality and translation. And like any other part of the research process, it should be reported transparently and consistently. So in my area of rheumatology, rheumatologists are familiar with being asked to report their PPI, and this is largely because several of the highest impact rheumatology journals are published by the BMJ, and they've required research papers to include a PPI statement, as Adrian told us earlier. But at the Lancet Group, we haven't routinely included this information in manuscripts. So if it's been included in a submitted manuscript, then that's all very well, but we haven't been asking for authors to actively report on their PPI until recently. Next slide, please. So in rheumatology, the question is PPI being reported? So in June 2024, we published this meta-research analysis that examined reporting of PPI in high-impact rheumatology journals. And by high impact, they looked at journals with an impact factor of 5 or more in the Clarivate category of rheumatology in the year 2021. And they included 141 articles that included prospective human studies. And what they found was that only 9% of these studies reported engagement of people with lived experience in the article. And 4% included people with lived experience as co-authors. So 3% reported that they did not engage people with lived experience in the article. But then the researchers reached out by email to those authors that hadn't reported any engagement, to ask them for further details of whether they had actually engaged lived experience. And what they found was that of the authors that responded, a lot of them who provided further information had actually carried out various aspects of PPI, but they hadn't mentioned this in their article. So engagement is happening, but it's not being reported. And this study estimated that somewhere between 29% and 44% of the research did actually engage people with lived experience. But it just wasn't being reported. And most of that engagement occurred in the planning stages of the study. Next, please. Oh, sorry, could you go back one? Thank you. So more broadly than rheumatology, there was an analysis published in the BMJ in 2025, so April this year, and they looked at reporting of PPI in clinical trials in 4 major medical journals. So that's the BMJ, JAMA, the New England Journal of Medicine, and the Lancet. And they looked at all areas of medicine and included the first 10 trials published in each of those journals in each year. And their analysis showed that only 18% of the trials reported PPI, and only 19% of the trial protocols reported PPI. So the level of reporting is very low across medicine. Okay, next, please. So at the Lancet Group, we've been working on how to improve reporting of PPI in our journals. So in January 2024, 3 Lancet journals began a 6-month pilot project asking authors to add detail on lived experience involvement in their research. So this project has been led by the Lancet Psychiatry. The comment you can see here was published in the Lancet Psychiatry announcing this project, and Jessica was involved in shaping this initiative. So the senior editor from the Lancet Psychiatry, Sophia Davis, worked with a number of the lived experience panel in order to decide which aspects of PPI were important for patients to know about. Next slide, please. So at the revision stage of a paper, what we are asking authors to report is on this slide here. So particularly important for the lived experience panel was that patient involvement should be stated in the abstract. So we are asking for a simple 1-line statement in the study abstract to state if any lived experience involvement in the study occurred, or to state if no lived experience occurred. So you can see this from the abstract, even if you don't read the full paper. In the methods section, we're then asking for further details of exactly how people with lived experience were involved in, for example, shaping the research question, choosing outcome measures, working as lived experience researchers, and writing the study up, and dissemination. And we're also asking if authors are comfortable to declare positions of lived experience. So as Jessica mentioned, it can be very empowering for patients, and we are open to authors of the pieces declaring their lived experience if they feel comfortable to do so. And then in particular in the discussion for studies where there wasn't any lived experience involvement, we ask for this to be discussed as a limitation of the study. Next slide, please. So these are a couple of examples of methods sections from the abstracts of studies that have been published in the Lancet Rheumatology after this 6-month pilot project. So you can see that we're just asking for a very simple statement that states whether there was lived experience or whether there wasn't lived experience. So there's an example of each here. In the top example, people with lived experience were not involved in the research or writing process. And in the bottom example, people with lived experience of low back pain were involved in this trial from the outset. Next, please. This graph is data from an audit of the research articles published in Lancet Rheumatology since we began this project. So the pink bars are the data from the 6 months after we started requesting this information. And the blue bars, or the one blue bar that you can see there, is what was happening before we started requesting this information. So 39% of research articles published in Lancet Rheumatology between June and December 2024, which is the 6 months after the project started, mentioned the involvement of people with lived experience or the absence of it in the abstract, compared to none of the articles published in the previous 6 months. So likewise, reporting of PPI in the methods section increased from 11% before we started asking to 57% afterwards. And these numbers have continued to increase in articles. So you can see in the purple bars the data from the first 5 months of this year, where we started routinely asking for this information. And 65% of these articles published this year report PPI in the abstract, with 85% of them reporting it in the methods. And in the discussion section, so this applies to studies that state that there was no PPI, then 21% and 30% of studies now discuss the fact that not having any PPI is a limitation of their study. So we've started to move the needle in the right direction, but we do have the power to police this, and because we only publish small numbers of research articles, we can check on each individual article. So we're hoping going forward that we can get this up to 100%. So next slide, please. So the future at the Lancet Group. So the journals that took part in this pilot are all continuing because we had very positive feedback from our authors and very high adherence. And across the Lancet Group, all clinical trials will now report PPI, and that's because the Consort 2025 checklist now requires that PPI is reported. So Consort is now requiring that PPI is reported. It's stated who is involved and stated if there is no involvement. So all of the Lancet Group journals will be adopting that in line with Consort. And then several other of the Lancet Group journals have also joined us in requesting this information. And then just a little bit of an advert that we have a PPI-themed issue of the Lancet Rheumatology coming in 2026. So keep an eye out for that. Thank you very much for listening.
We have time for one question, if anybody has a question for Dr. Clark.
Thank you very much, Anne. Derek Stewart, work out of the UK, but I'm here in Dublin. Just asking to report on whether there is involvement is brilliant. Thanks for doing that. You might like to subdivide. There's a difference between being involved to give an input and an insight into a research project, and it's very different from being a co-applicant on a bid or being on the trial management group. So having a subsection that describes what the involvement is would be helpful. Because if you're doing a literature review, you can't find that differentiation. Thank you very much.
Thanks, Derek.
Thank you. Yes, yeah, I completely agree that obviously there's the potential for tokenism without actually having meaningful involvement. So in the main methods section, we do ask authors to describe in further detail the kind of engagement and involvement that occurred in their study. Yeah, we don't police this. So we're just asking for them to be honest and explain what they did. And it doesn't have any impact on our decision making to the paper at all. So yeah, we're relying on honesty of authors.
Good afternoon. Thank you very much for your presentation. I'm just wondering how patients get involved, what training is involved, and how you measure that and that comes from that.
So within the Lancet group, the direct involvement of patients has all been led by the Lancet Psychiatry. And they have their own training programme for peer reviewers that Jessica has been involved in. And otherwise, we basically just invite people to reach out to us if they are interested in being involved in any aspect of the publishing process. We do encourage lived experience authors on all of our research articles, and also when we are commissioning reviews, we are looking for lived experience involvement in reviews so that we are giving patients the voice in those types of articles as well.
Thank you. I just was wondering, because would you have in the lived experience of rheumatology, how they would be involved. So will you be recruiting lived experience editors to the team?
Well, I do actually have lived experience of a rheumatic disease myself, so we do have lived experience editors on the team.
Thank you for being so open and sharing that. I live with rheumatic muscular disease myself.
Thank you. It was a pleasure.
Thanks very much, Anna.